Welcome to the training for healthcare professionals. Let's begin with the module which focuses on standard precautions. Let's take a look at the key learning objectives. After completing this module, you will be able to apply the basic principles of infection control, perform proper barrier isolation for patients, and maintain standard contact, droplet, airborne precautions. Perform proper hand hygiene. Let us understand the meaning of an infection. An infection is the invasion of a host by pathogen or microorganisms resulting in disease. An infection that transmits directly from one person to another through contact, droplets, or air is known as communicable or contagious disease. Therefore, infection control involves gown and gloves when assisting with direct patient care, using correct hand hygiene techniques. Different modes of transmission of infection are direct contact, person to person, hand to skin. Indirect contact, touching inanimate objects, contaminated equipment or hands of healthcare workers. Droplet, large particles that travel up to 3 feet and come in contact with the host, for example through sneezing, oozing wounds. Air, droplets suspended in the air, for example coughing, sneezing, talking, etc. Let's find out why infection control is important. Infection control is one of the most important aspects of health and environmental safety. Healthcare-associated infections are one of the top 10 leading causes of death. Increase in drug-resistant microorganisms lead to more severe infections. Infection prevention and control help to reduce overall cost compared to the cost of treatment. Let's find out when standard precautions should be observed. Providing direct patient care, handling blood or body substances, performing invasive procedures including cannulation or catheterization, risk of splash or splatter to mucous membranes, providing care that can induce coughing, handling and disposal of waste or sharps, handling or preparation of food. Let's see why contact precaution is important. When germs can spread through contact within and outside the hospital environment, contact precaution needs to be maintained. Patients with weak immune systems are at greater risk of contacting infectious diseases. Following contact precautions informs the healthcare staff of a need for extra vigilance. They can prevent the spread of these germs to other vulnerable patients by wearing a gown and gloves. Let us understand what contact precaution involves. Place the infected patient in a single room if available. The door can remain open. Wear a long-sleeved gown and gloves every time you provide direct care to the patient or when you have a lot of direct contact with the patient environment. Place a sign on the door to remind others who enter the room about contact precautions. Clean and disinfect the room and equipment regularly. Clean hands every time you enter and leave the patient's room. Let's find out why droplet precautions are important. Infection control is one of the most important aspects of environmental safety. Droplet precautions are intended to prevent transmission of pathogens, to prevent the transmission of microorganisms by droplets larger than 5 microns in size generated by a patient coughing, sneezing, or talking. Let's understand what droplet precautions involve. A single patient room is preferred for patients who require droplet precautions. There should be spatial separation of 3 feet between the infected patients and the caregivers or visitors. Patients on droplet precautions who must be transported outside of the room should wear a mask. Nurses must wear a mask in addition to gloves and a gown when working within 3 feet of a patient or when entering the patient's room. After patient use, both linen and food trays must be sent directly for cleaning and disinfection. Nursing staff must instruct family and visitors to wash hands after contact with patient secretions or contact with immediate patient environment. Let us understand the importance of airborne precaution. These precautions are implemented when patients are known or suspected to be infected with pathogens that can be transmitted by the airborne route. They are designed to reduce the risk of airborne transmission of infectious agents. Patients with weak immune systems are at greater risk of contacting airborne diseases. Let's understand what airborne precautions involve. Single room for one patient and door must be closed even if the patient is not in the room. Arrange for, with negative pressure ventilation, earlier known as TB rooms, with 6 to 12 air exchanges per hour. Ensure appropriate discharge of air outdoors, or ensure that a high efficiency filter is in place for room air that is recirculated. Everyone wears high efficiency mask, P2 or N95 masks, upon entering the room. The patient must wear a surgical mask if needed to be transported. Let's find out who can get affected and when. All patients with contagious infections or diseases such as scabies, meningitis, localized shingles, pneumonia, congenital rubella, mumps, diphtheria, rubella, rotavirus, pneumonic plague, TB, SARS, SARS, major draining wounds. Here's a checklist of the items. 1. Gloves. 2. Gown. 3. Masks. 4. Hand wash stations. 5. Soap. 6. Alcohol rub. 7. Towels or tissues. Let's look at how we can maintain standard precautions. Hand hygiene. Hand hygiene is the single most effective way to prevent infection. Wash hands between patient contact. Use alcohol hand gel when hands are not visibly soiled. Natural nail tips should not be longer than 0.63 centimeters, a quarter of an inch, long. Avoid wearing hand jewelry. Personal protective equipment, PPE. Don personal protective equipment, PPE, when having direct contact with patient or equipment in the room. For example, gloves, gowns, masks, eye protection, face protection. Gloves must be worn when in contact with blood and body fluids. Gowns must be worn during procedures or situations where there will be exposure to body fluids, blood, draining wounds or mucous membranes. Masks must be worn during procedures likely to generate splashes or sprays of blood, body fluids, secretions or excretions. Remove and dispose PPEs prior to leaving the patient's room. Patient stay and transporting. Patient stay. Private room or with patients with same disease. Transporting. Limit the movement and transporting of the patient from the room for essential purposes only. Hospital environmental controls. Clean up spills with proper technique and disinfectants. Never recap needles using 2 hands. Discard sharps in approved puncture-resistant containers only. Keep food away from possible infectious materials. Never pick up glass with bare hands. After patient use, both linen and food trays should be sent directly for cleaning and disinfection. Dedicate equipment for individuals on infection precautions or isolation. Points to remember. Standard precautions. Print a standard precaution, stop sign or isolation sign. Organism, disease name, patient diagnosis must not be written on the sign. Single room with own bathroom preferred, or infected patients can be roomed together if not available. If the patient needs to be transported, he or she should wear gloves, or the site of infection should be concealed with an impermeable barrier during transport. Healthcare persons should wear a gown if physical contact with the patient or environment is likely. Separate equipment must be used for the patient and then should be decontaminated immediately after use. Make sure the visitors wear gloves upon entering the patient's room and dispose them correctly after use.
Hello, I'm Dan Diekema, the Director of the Division of Infectious Diseases and the Associate Hospital Epidemiologist here at the University of Iowa Hospital. Today we're going to be talking about standard and isolation precautions. Why should you be concerned, you ask? Because these precautions protect you, your coworkers, our patients, and visitors against the spread of infection. First, we'll be talking about standard precautions. You should use standard precautions in caring for every patient, regardless of that patient's diagnosis or whether that patient has an infection that you know about. A crucial step in standard precautions is hand hygiene, which is the absolute cornerstone of infection prevention. Standard precautions also requires the use of personal protective equipment depending on the tasks that you're performing. For example, if you're drawing blood, you need to wear gloves. Other tasks might require wearing a gown, a surgical mask, or eyewear. All of these will be covered in detail during this video. In addition to standard precautions, we have what we call isolation precautions. There are 3 categories of isolation precautions, and each one involves a different sign on the door to the patient's room. I will show you an example of each of these signs. The most frequently used form of isolation precautions involves this orange sign, which is for contact precautions. This sign and these precautions are used when a germ is transmitted by direct or indirect touch, such as touching body fluids or touching equipment in the patient's room that might be contaminated. A certain type of germ, called Clostridium difficile, is also listed under contact precautions and is indicated by this pink sign. If you see this sign, this means that staff must use hand gel or foam when entering the room, but must use soap and water when exiting the room. The next type of isolation precautions is designated by this green sign, which is for droplet precautions. Droplet precautions are used when a germ is transmitted by big droplets in the air that settle quickly, such as when a person coughs or sneezes. And finally, the last type of isolation precautions is designated by this blue sign, which is for airborne precautions. This means that a germ is transmitted by small droplets that travel for long distances in the air. Because these are small enough to remain airborne for a long period of time, airborne precautions involves special rooms that have different air handling capabilities. Now you will see scenarios that illustrate implementing every one of these types of isolation precautions.
Let's discuss contact precautions. Contact precautions are infections that are spread by direct or indirect contact, such as touching any body fluids or touching the equipment in a patient's room. Patients diagnosed with C. diff, VRE, and MRSA need to be placed in contact precautions. Let's watch a scene where a nurse is caring for a patient in contact precautions for C. diff. See if you can identify what goes wrong in this situation.
Hi, Mrs. Johnson. I'm your nurse today, and you're going to go for an x-ray. So I want you to get ready. I bought you a cap to put on, some gloves, a mask to put over your mouth and nose, and a gown. Okay? If you need any help, just let me know.
Okay. While it may seem like the nurse was being careful by putting on all PPE, contact precautions only require hand hygiene, gown, and gloves before performing patient care. In this case, the nurse was preparing the patient for transport. The patient should wear a clean hospital gown or robe and wash their hands before exiting the room. The nurse should notify the receiving department of the patient's isolation status and wipe the patient's bed rails with bleach wipes. She should also remove all PPE and wash her hands before leaving the room. Let's watch as she does it the correct way.
Hi, Mrs. Johnson. I'm your nurse today, and the doctor wants you to go for an x-ray.
Okay.
So we're going to get you ready to go, okay? First thing I want you to do is wash your hands. Yeah, and I can see that you have a nice clean gown on.
I just put it on.
Okay, that's great. We're going to wipe off the handrails before we leave the room.
Okay.
Okay, with a bleach wipe,
Okay.
and then we'll be on our way.
Okay.
All right.
This person is orange contact precaution room. Looks like I'll be using bleach wipes.
That was much better. We also added the environmental service team member at the end to bring your attention to their role in isolation precautions. It's important to note that for cleaning rooms under contact precautions, EDS must clean with bleach wipes to account for some organisms' ability to live on surfaces for hours. The next type of precaution is droplet precautions. Droplet precautions are needed when germs are spread by big droplets in the air, such as when a patient sneezes or coughs. Examples are many respiratory viruses, influenza, and influenza-like illnesses. Let's take a look at a situation where a respiratory therapist goes in to see a patient in droplet precautions. See if you can identify what is being done wrong.
Good morning, Mrs. Green.
Hi.
How are you feeling today?
Oh, pretty good. Got a cough.
Did you notice that the respiratory therapist did not perform hand hygiene or wear a mask before entering the room of a patient in droplet precautions? By doing this, she's putting herself and others at risk. Let's watch as she does it the correct way.
Oh, goodness. Good morning, Mrs. Green.
Hi, how are you?
How are you feeling today?
A little better. Still have this cough.
Ugh.
The last type of isolation precaution is airborne. Airborne precautions are needed when germs are spread by very small droplets in the air. Examples include TB, chickenpox, and measles, among others. Patients must be placed in a negative air pressure room, and staff must wear an N95 respirator or PAPR when entering a room. Let's look at a scenario where a nurse interacts with a patient who has TB.
Hey there, Miss Johnson. I heard your call light going off, so I wanted to go ahead and silence it. Is there something I can get for you?
I'd like some water, please.
Okay, I'll just be right back, okay?
What did you notice in this situation? The nurse did well choosing the correct PPE, but she took off her N95 while she was in the room. By taking off her N95 before leaving the room, she put herself at risk because she was exposed to TB. Let's watch again as the nurse does it the correct way.
Hey there, Miss Johnson. I heard your call light going off. Can I get you something?
Can I get some water, please?
Absolutely. I'll be right back, okay?
Okay.
In summary, you've learned now about standard precautions and the three types of isolation precautions: airborne, contact, and droplet. Some extremely important points to remember. Hand hygiene is absolutely the most important way to prevent infection in the hospital. Second, when wearing gowns, make sure that you secure them. Don't let them hang loose around you. And please do not reuse gowns for isolation. Third, wear a mask if you are coughing. Fourth, think about the tasks that you'll be performing before you enter a patient's room so that you make sure that you have the right personal protective equipment. Fifth, Remember, isolate the germ, not the patient. Thank you very much, and remember, infection prevention is in your hands.